What is leptospirosis?
Leptospirosis is a bacterial disease caused by Leptospira bacteria that affects both humans and animals.
How is leptospirosis transmitted?
It is caused by exposure to usually urine of infected animals. That's the most common in terms of urine, but also other body fluids of infected animals, including if you have dead animals that have been infected with leptospirosis in waters, then of course that can lead to the bacteria being present in the waters and being able to affect individuals. So usually, it follows history of heavy rainfall. Usually persons who are in the fields and in water, farmers, etc., would have a high degree of exposure. And, when persons have cuts, bruises, then the organism can enter the body through those areas. And it of course, if it's contaminating the food or the drink, then of course it can enter the body through that means as well as if you have the dirty hands coming from leptospirosis infected waters and it is touching any of the mucous membranes, the eyes, inside the nostrils or inside the mouth, then you can become infected with leptospirosis.
How does the disease present?
90% of the time it's a mild flu-like illness, and persons will take paracetamol that will relieve their discomfort in terms of their pain, their fever, and it will settle. However, 5 to 10% of cases can progress and especially go on to involve the liver and the kidney and result in severe disease. And in some occasions, less than 5% of cases, we can get involvement of the brain, leading to infections of the brain and in the fluids around the brain. It can also involve the lungs, with bleeding in the lungs and with respiratory failure. So in terms of the mild cases, in some instances, persons have no symptoms at all, so they are asymptomatic. But the mild symptoms that you will get include fever, headache, muscle pain, red eyes, stomach pain, and diarrhea. Sounds a lot like dengue, and it sounds a lot like a lot of other illnesses. And so therefore, with the level of exposure that persons would have now to contaminated water, we have to have a high level of suspicion. When are the symptoms severe? If the symptoms are severe, then you will have a worse prognosis, a poorer outcome. And persons will go on to get chills, nausea, vomiting, and yellowing of the eyes is one of the common symptoms that persons look out for when they usually suspect that leptospirosis is probably there. You will see a change in the urine. The urine becomes dark or orange colored, and then the urine becomes significantly less as the infection now starts to affect the kidneys. And then you can have bleeding at various points of the body. You can get coughing up of blood, or you can get passage of blood in the stool. You can also get an inflammation around the heart, and this presents with symptoms such as irregular heartbeat and tiredness, fatigue, etc. Shortness of breath, swollen feet, difficulty in lying flat. These are some of the more severe symptoms that you can get with leptospirosis. And by this time, you definitely should be in the hospital. How is it treated? For the mild symptoms, we treat symptomatically as we treat with most viral illnesses. Although this is not a viral illness, it is a bacterial illness, which is good because it means that we can treat it with antibiotics if we get the patients presenting early. For the severe cases, we would have to use intravenous antibiotics to ensure that the antibiotics are getting to the areas that it is needed very quickly. And so these persons need to be in hospital. If it affects the kidneys and results in kidney failure, then persons may have to go on dialysis. And if it affects the lungs severely, then we may have to aid persons breathing by using a ventilator. But for the most part, when persons are in hospital, it is supportive care, trying to maintain their fluids by providing IV fluids, giving them blood and blood products if it is necessary. It really is dependent on which organs in the body is affected, but severe cases usually require more comprehensive treatment, and persons are treated in hospital, and some may have to be treated in high dependency and even in intensive care settings. Conditions exist for the contamination and the infection. If you develop symptoms, you need to seek medical care early. Treatment is available, and most cases can be treated successfully.